Good morning, welcome to Westminster for our live Q&A with the Health Secretary, Matt Hancock. Lovely to see you.
Good to be here.
Health Secretary, thank you. Over the next 30 minutes or so, we'll be putting questions from you, our viewers, to him about the coronavirus. The UK has now recorded the most deaths in Europe and is the second worst hit country in the world. And COVID-19 has left us living in lockdown for weeks and weeks and weeks. What does the future hold? And will we beat it? Thousands of you have sent in questions, literally thousands, Health Secretary, I have to tell you. We'll be asking the man who's been leading us through this crisis and ask him about what we need to do about coronavirus. He himself, of course, has fallen victim to it. To answer some of them, he's here in just a moment.
Yesterday, the Prime Minister announced the most radical steps yet to slow the spread of this virus. These steps are not requests, they are rules.
As a human being, what are you most worried about at the moment, Mr. Hancock?
Well, there's so many things. Upon medical advice, I was tested, and that test has been positive, so I'll be self-isolating. I am now setting the goal of 100,000 tests per day by the end of this month. The opening of the 4,000-bed NHS Nightingale Hospital, I pay tribute to everybody involved in putting this together in 9 days. Tracking and tracing will allow us to get R down and hold R down. If you're watching this and you live on the Isle of Wight, I have a simple message. Download the app to protect the NHS and save lives.
And from when we told you that we were going to pose questions on your behalf to the Health Secretary, we've had literally thousands of you wanting to take part. So let's press on and get through as many as we can, Health Secretary, if you wouldn't mind. Let's start with Doug McLaren, who wants to ask about Neil Ferguson. And this is what he is saying. Has Neil Ferguson been fined by the police for breaking lockdown rules? And if not, why not?
The answer to that is I don't know, Doug. The first I heard about this was when I read it in the newspapers. It's not a story I've been close to, but clearly the social distancing rules are there for everyone, and they're incredibly important and they're deadly serious. And the reason is because they're the means by which we've managed to get control of this virus.
Should he be prosecuted?
Well, you can imagine what my views are, but that is absolutely a matter...
I can't imagine. Tell me.
It's a matter for the police. As a government minister, I'm not allowed to get involved in the operational decisions of police matters.
No, of course.
But I think that, you know, the social distancing rules are very important and people should follow them.
I mean, we saw what happened with the Scottish Chief Medical Officer, didn't we,
Yes.
Catherine Calderwood, and she was warned by the police.
Right.
Was that the right decision?
Well, absolutely, I back the police. Back the Scottish police, and I'd back the police here. They'll take their decisions independently from ministers. That's quite right. It's always been like that. And that's why, even though I've got a clear answer to what I think, it's as a minister, the way we run the police is that they make decisions like this.
Yeah.
So I give them their space to make that decision, but I think he took the right decision to resign.
Well, you said you read it in the papers. I mean, what did you think when you read it? Did you bang your head on the desk?
Well, it's just, it's extraordinary. And, you know, I don't understand
Sounds speechless.
I am. That doesn't often happen to me, Kay.
I know.
And but I am. I am. And you know, Mr. Ferguson Professor Ferguson is a very, very eminent and impressive scientist. And the science that he's done has been an important part of what we've listened to. And I think that it's I think that he took the right decision.
You wouldn't have...
To resign, that is.
Yeah, you wouldn't have fought to keep him.
It's just not, that's just not possible in these circumstances.
Final thought, just before we move on to the next question. I mean, one of his defences was that he'd already had COVID,
yes.
like you.
Yes.
So as a result, it's OK to social distance.
Well, do you know what? I asked exactly that question of the Chief Medical Officer after I'd had coronavirus. And there is normally there's immunity and you're much lower risk from a coronavirus if you've had it recently. But we don't know that for sure. And there's so many new things about this coronavirus that we don't know that that's the case. So I asked exactly that question of the Chief Medical Officer. Can I behave differently because I've now had it? Do I still have to do the social distancing? And the answer was very clear, which is yes, we all have to abide by social distancing. Now, as it happens, we do have this, a scientific survey in the field right now to find out if people who have definitely had it because they tested positive and have the antibodies, if they then get it again.
Yeah.
And if they don't, then we'll know scientifically that for people who have had it and have been tested to have the antibodies, that they can go about in a much more low-risk way. And if that science comes through, as we do expect it to, then we will be able to say that people are lower risk if they've had that positive antibody test. But we don't know that yet, and that's why the rules are the same for
And if
everyone.
that proves to be the case, can he have his job back?
Everybody's got to follow the social distancing rules.
OK, our next question is from Linda from Whitwell, which is in Derbyshire, and it's a video. This is what Linda wants to ask you.
I am one of the very vulnerable patients who is being shielded. Am I going to have to wait until a vaccine has been developed before I can hug my children and grandchildren and see my friends? Or are there any other options being considered to guarantee my safety outside lockdown?
Health Secretary?
Well, thank you. That's a really important question. I know it's a question a lot of people are asking. Now, those who are shielded are those, just to be clear, are those who've specifically received a letter from the NHS saying that they are clinically extremely vulnerable to this disease. This is not the rules for the all over 70s, which are who are in a different category. So the answer I'm going to give relates to the shielded who've specifically received a letter from the NHS.
So you have to have this
and I want
letter,
to make it clear, because there has been some confusion between those two groups.
Yeah.
And the answer is that we asked those who are being shielded to to avoid as much human contact as possible for 12 weeks. That we may have to extend that 12 weeks, but we hope not to. And the answer is we may well be able to release some of those measures before a vaccine is available, if we can get the level of new cases, the number of new cases right down. So in some countries, they've managed to now get the number of new cases right down, and that if we get there, if we succeed in doing that, then we will be able to take clinical advice on whether it's safe for those who are shielded to be able to, for instance, hug their grandchildren. I understand the emotional impact that this is having, and there are many people who haven't left their homes now for 6 weeks or so. That is a long, long time, especially if you don't have a garden. And so that's right at the front of my mind. And making sure we get the rules around those who are shielded right is really important. And we will take into account not just the impact of coronavirus, but also the wider impact on people's physical and mental health from being stuck at home for such a long time.
And what about if they manage to squeeze in a cheeky hug with their grandchildren? Would they, in your view, still be treated in the same way as Neil Ferguson?
Well, everybody
Breaking
should
the
follow
rules?
the social distancing guidelines. However, what I'd say is that those who are shielded, they're shielded for their own protection. And of course, we all must follow the social distancing guidelines for the protection of public health, but the specifically very strenuous rules for those who are shielded are for their protection over and above the broader social distancing rules that we must all follow.
OK, let's listen to Brian. This is Brian's question. What if a vaccine can't be found for COVID-19 is what Brian's asking.
Well, if a vaccine can't be found, then we have to learn to find a way to live with this virus, which means getting the numbers right down and then holding them down through, for instance, mass-scale testing and tracing the virus through a combination of the technology and human contact tracers. And, of course, we're working on treatments, that is to say, drugs that can make sure that if you do get ill with coronavirus, it isn't life-threatening in the way that it is now.
But it's not a guarantee we'll find a
But
vaccine,
none
is
of
it?
these, it is not a guarantee we'll find a vaccine. We're doing everything we possibly can, that we're putting as many resources into the scientists, brilliant scientists who are leading this. The UK has two of the top 10 projects in the world. In fact, 3. There's one new one coming along from GlaxoSmithKline and Sanofi. So we've got 3 potential vaccines, 2 of which are really 2 of the world leaders. But we're working with countries around the world so that whoever develops a first successful and safe vaccine will be able to
OK, we're lucky
to
to have you and to get through as many questions as possible. As I said, we've had many thousands. This is from Ryan. It's a video about the 2-metre rule.
Oh, yeah.
We wouldn't be able to operate in that situation. We've got such a small CAF. We wouldn't be able to get people in. That's our big worry. Are restaurants going to have to go back to work in these circumstances, or can we still stay closed until these restrictions are eased and get full support from the government?
He represents so many of the questions we've been asked.
Yeah, so this is another really important question. And the Business Secretary is working on the rules for safe working so that we can try to, when we get the rate of new infections down, we can work on how people can get back to work as safely as possible. And we're going to say more about that very shortly.
Might you reduce that distance? Because some countries it's like 1.5 metres, isn't it? Not 2 metres.
Well, the 2-metre rule is based on the best scientific advice, and the problem is the more you reduce it, the easily the virus spreads. And it isn't linear in that if you halve it, you don't just double the likelihood of of the virus spreading. You increase it exponentially. So we're very careful to follow the clinical advice on the 2-metre rule. But of course, there's also very strong evidence that outdoors the spread is much, much lower. So there may be workarounds that some businesses, for instance, cafes, especially over the summer, might be able to put in place.
OK. There are, of course, other illnesses that people are being dogged by at the moment, not just coronavirus. And many people feel that they are being left out, not least cancer patients. And this is from Joe. And this is what Joe is saying. Why is the Excel Centre in East London not being used as the epicentre of COVID-19, freeing up hospital space and making it safe for other serious illness treatment? So take the COVID-19 people to the Nightingale that you've just shut down, and then other people can be treated better in their environment. Well,
we're taking this principle, which is very a sensible principle, and putting that into place within existing hospitals, within the mainstream hospitals. And the reason for that is that many people with coronavirus also have other conditions. And the Excel Centre, the Nightingales, are designed for people who only have coronavirus and don't have other underlying health conditions. And we now, thankfully, the numbers who are in our intensive care wards are much lower. They're about half what they were at the peak around Easter.
Yeah, but Joe's point is, why not put them all together in the Nightingale?
So what we're doing is within hospitals, we're separating the hospitals into COVID and non-COVID areas, and that means that if people have more serious complications, they're actually safer in a full-blown hospital that has the full intensive care capabilities. So we have looked at this question, and because the numbers in hospital are now coming down, we're able to support people within mainstream hospitals.
People wouldn't be as safe if they went to the Nightingale hospitals, is that what you're saying?
The facilities are better in the main hospitals, that's right, absolutely. Because the Nightingale is there, the Nightingales are there to treat only coronavirus. Many people with coronavirus who are in intensive care also have other complications that the Nightingale wouldn't be as well placed to deal with. So it is, in fact, it's safer if you've got coronavirus to be treated in a mainstream hospital. But also we are separating out within hospitals the coronavirus from the non-coronavirus areas to reduce the spread of the disease within hospitals.
So Nightingale is there as extremists, really?
It is there to stop it was there to stop the NHS being overtopped. And, one of the good things that's happened in this crisis is that the NHS has always been able to have the capacity. We haven't had the situation we've seen in other countries where the health system's been overwhelmed.
Yeah, but just to answer Joe, I mean, cancer patients are still going to have to wait longer than normal, aren't they?
So we're restarting cancer treatment. There is a challenge with some cancer treatments when it takes your immune system right down to zero, that is not a wise thing to do when there's an epidemic going on. That's irrespective of what's available in the NHS. But a lot of cancer treatment has carried on through the crisis, of course, because it's time critical. And those parts that we stopped for less time critical cancers, no cancer is not time critical, but for the less time critical cancers, we're now beginning to restart and doing that in a safe way. The absolutely critical message for viewers is that if you are advised by your clinician to go to a hospital appointment, you should go, because they will have taken into account the COVID risks as well as the risk of
so there will have been that risk assessment, and
That's
you
right.
should keep
you
your
really should
appointment.
follow the advice. If you're told to go to hospital, please do.
Doctors, of course, are taking precautions as far as PPE is concerned. Dentists, that's a big issue. Dentist appointments are something people are having to cope without at the moment. A question for you here from Dr. Okoya.
Patients are in pain, dangerous swellings. Primary dental care is in danger of collapse because private practices who support the NHS with up to 60% of funding have had no help from the government, no rates relief, no grants, and things are in danger of collapse. What are you going to do about it?
So dentistry is another really important area that we want to get started again as soon as it's safe to do so. So there have been arrangements put in place for emergency dental care. So for patients who've got something urgent, there are almost 200 centres around the UK, around England, I'd say, for emergency dental care. But we have advised people not to take up routine dental checkups. In fact, I had to delay mine, that was obviously as an important precaution, because by its nature, your dentist is close to you when they're looking at your teeth. I'm working with the British Dental Association. I understand the impact because many people pay privately to go to the dentist, and that, of course, is having a business impact on dentists, alongside the lack of NHS work, because we're not recommending people go for routine checkups. So it is something that it's really important that we support our dentists through this through this period.
Will be open again.
As part of the restart of the NHS, that's something that we're working on.
A weeks, a month.
I hope in that sort of time period, yes.
So you'll be able to go.
Yeah,
back
but
to
I can't give a
dentist again.
concrete answer because it depends on the rate of the new transmissions of the virus coming down, which makes things safer right across the board. But I very much hope then that
you realise how urgent it is.
I do. I get it.
Okay. Fertility treatment
Yes.
is something. I know you've spoken about actually
Yes.
in Downing Street when you were doing one of the news conferences. It's something that Carla from the Forest of Dean was going through before lockdown. And this is what Carla says. Can there be some guidance on when cancelled operations due to COVID-19 would be rebooked? As a woman of 34, severe fertility issues, it's absolutely soul-destroying, knowing each day I am waiting. My chances of becoming a mother are just slipping by.
Yes, well,
Heartbreaking.
It is heartbreaking, and it's something that I've seen the wonders of IVF in my own family, not me personally, but close family, and so I know how important it is for you, Carla, and for other people in your circumstances. I'm really pleased that we have been able to restart fertility treatment. We announced that last week. Now, of course, fertility treatment was paused for just over a month, and therefore there will be a backlog to get through. But we've been able to get that restart going, And I very much hope, Carla, that you get your appointment sooner rather than later, because of course I understand how urgent it is for people who want to start a family, and also how wonderful it is when it goes right.
I'm sure the medics that are involved with PPE, they would still get, with IVF, forgive me, they were too many acronyms, they would still get the PPE as necessary, would they?
Yes, of course, it's important. And that they'd get the PPE that is required by the guidance that's been set out.
Okay.
Yeah.
The next question is from John in Edinburgh, who is asking about care homes.
Did you sacrifice the elderly people in care homes so that you could ensure that the NHS were not overrun?
No, we didn't do this.
You can understand the question. You can understand why people feel that way.
Well, what I'd say is that we have, from the start, worked very hard to protect people in care homes, and actually the proportion of people.
Why do you think they feel that you didn't?
Well, I don't know. I think that there hasn't been as much until this crisis. There hasn't historically been as much discussion in the public debate about the support that is given to people in care homes. And I'm really glad that actually one of the things that's happened as we go through this crisis is that there has been much more discussion of that. We put in place the first guidance to care homes in February. And when large numbers of people were left hospital to create the space in the hospital to deal with COVID-19, that was before there were many cases of coronavirus. And then since then, we've put in place the rules that are in place, in England at least, for testing everybody as they leave hospital to go into care homes.
Should have done that to start with.
Well, the problem was that the testing didn't exist, and we had to build that testing capacity, as has been a subject of widespread discussion.
So it wasn't as if it was a mistake, it was just that you didn't have the capacity?
The testing capacity didn't exist in this country, and we've had to build that throughout the crisis.
What would you do differently as far as care homes are concerned?
Well, I think it's very hard, because I feel like we put a huge amount of effort and resources behind supporting care homes from the start. Maybe we should have explained that more clearly. And I think that there's the challenge with care homes in this crisis is that, of course, many of the most vulnerable people, vulnerable to coronavirus, because it hits older people much harder, are in care homes. So by their nature, they are some of the most vulnerable areas.
But you feel that you protected them as well as
I feel like,
even though the testing
look,
wasn't
there will be
available
there's a time for going over the history of this, but now the most important thing is that we get we protect people in care homes as much as possible, including using the new testing to make sure that we protect people in care homes as much as possible.
And you wish you could have had that testing earlier?
It would have been wonderful if we'd gone into this crisis with a global scale diagnostics industry, yes. But in the way that, for instance, Germany did, but we went in more like other countries like France, which similarly have had to build a testing capability from almost from scratch. And now we're able to have those tests, the asymptomatic tests. We weren't before, not by a lack of effort by the people who work on my team, who've been absolutely amazing on this, but because we just didn't have that capacity as a country.
OK, this next question is from another young viewer, and that is James. He's 16 and he has autism. He wants to know, there he is, he wants to know when he can go back to school. This is what he said.
I miss college, I miss my friends. Please can you give us a clear answer when I will return to college? And how will education recover after when this coronavirus pandemic is over, please?
What would you say to people like James?
Well, we didn't want to shut schools and colleges, but we had to, because
Did we have to, though? Because,
Yes.
I mean, other countries didn't.
Yeah, we really did, yeah.
Why?
Because although children don't suffer from the consequences of coronavirus nearly as much as adults. There have been a small number of very sad cases, but by and large, children are not affected by the disease, don't go down with anything. They still spread it. And that means that that colleges and schools are a place where lots of people from different households, the children, come and mix, and that proved to be a real spreader. So the colleges and schools were perfectly safe for the children, but it helped to spread the disease. Now, we're considering now how we can get that restarted in a safe way when it's right to do so. But
when is it right to do so?
Well, it's too soon. And I know it's frustrating, and I heard
parents watching at home are tearing their hair out, aren't they? They're saying, "Oh, I'm doing the homeschooling as best I can.
I know.
I need to get him back to school."
Look, I have 3 children who are currently homeschooling, and I'm not able to help with that very much. But my wife is, and she has to put a huge amount of effort into it as well. And we know that it's imperfect. I mean, thanks to technology, at least it's better than it might have been in the past. But that's, I totally understand the frustration of those who want to get back to school. In fact, I admire children who want to get back to school because they want the social part
really,
as well.
We're looking at September in all seriousness.
Well, we've just, it is just so important that for all the reasons that we've been discussing, that we get the rate of new transmissions of the disease down. And if there is something that we can do before then we will. But I can't make any promises.
Yeah, but September's on the horizon, isn't it? Start of the new term, that's probably, in all seriousness,
I know, it's tempting to give concrete answers, but the problem
Our viewers
is...
just want something that they can look towards.
Of course they do. And I think, I'm not, dodging the question. I'm answering really directly. We don't know. And we don't know because we've got to see the progress of the disease. And we don't know how people are going to behave in terms of in terms of the lockdown measures, which are the thing that's having the biggest impact on getting the disease right.
June.
So I understand the frustration of people wanting to know the answer. Will it be June? Will it be September? For what age groups as well? Because there's other countries have taken different decisions for different age groups, and it would be really. I'm tempted to prejudge those decisions, but we just don't yet have the data. But I think we're coming to a position when we, relatively soon, we might be able to. I hope so. Okay. I hope so. Yeah. So I'm very sorry that I haven't been able to directly answer your question. It's not because I don't want to. Yeah. It's because it wouldn't be responsible of me to.
What are you good at teaching at home when you do the homeschooling? What's your subject?
Oh, I'm terrible at it. Yeah. I'm terrible at it. I'm not very patient.
How old are they?
6, 12 and 13.
OK, so you do a bit of politics with them?
Oh, lots of discussions of politics, yeah, lots of that. Lots of history. Yeah. Lots of discussions of history. Actually, the thing I like teaching most is maths.
Oh, really?
Yeah, because I like the clarity of maths, especially at that age when I can understand it, and the clarity of teaching maths is...
OK. When lockdown finishes, remind me not to go to the pub with you. A question from John Fletcher, who is in Reigate. Here we go. Hi, John. Can it really be just a coincidence that the virus originated in a city where there are 2 laboratories researching coronavirus?
Well, we have looked into this, and we don't have any evidence that this
Americans say they do.
Well, there isn't evidence that this is a man-made coronavirus, and there's and so I haven't. I understand what John's getting at, but we haven't seen any evidence of that link.
OK. Have the Americans shared any evidence with us at all? Because we heard from the president, didn't we? And he said that there is a link.
The president. Phrased
You're tiptoeing through the raindrops here.
He phrased his comments very carefully. We haven't seen any evidence of a link, and so there's nothing that I've seen that confirms the discussion, the allegation that John's referring to that I know is something that people are talking about.
What if it turns out that it was from one of these labs? That's a whole new discussion with China then, isn't it?
Yes, I mean, there's so many what-ifs about this disease, and there's so much to learn afterwards when we look at how it was handled to make sure that we're more prepared in future. I mean, one of the things is at some point, the evidence appears to be that the disease jumped from an animal to a human, and trying to make sure that we stop that happening again. That is in the global interest. It's not just a matter for one country. But if it accidentally came out of a lab and it's literally caused havoc right around the world, then the Chinese have got some serious questions to answer. Well, you're tempting me into a hypothetical answer, but
not according to the Americans.
Well, if you let's look at the actual evidence, and I haven't seen any evidence of that.
Have you asked for it from the Americans?
Well, look, of course I am interested in where this came from, but I'm actually more interested in how we get the country back on its feet.
So we've asked them. We'll wait to see what they say. Donald Trump rated his performance during the pandemic as 10 out of 10. This from Stuart. How would you rate your own performance?
Well, Stuart, I would say that I'm constantly trying to learn, and constantly trying to understand what's gone well and what can be improved. There are some things that we've had to change because it didn't work first time round. And so I'd give you a more humble response than the president.
So you're an 8?
Well, I'm not going to put a figure on it, obviously, but there are things that we've learned. I'll give you one example of something that we learned and we changed. We put in place guidance around funerals, and that guidance was interpreted in a different way to what we expected. And then I saw some funerals were taking place with no loved ones nearby, and that was terrible. And so we changed the guidance. We should have put the updated guidance in the first place and said to everybody, it is okay to have a small number of members of your family at every funeral. Of course you can socially distance at a funeral, as long as there aren't too many people there.
It was a 13-year-old boy that was being buried.
Yeah, well, I've talked about that, and it really affected me actually, watching him being buried by men in hazmat suits rather than with his loving family nearby. And that's one example of something that we should have done differently first time around.
What other mistakes have you made?
Well,
off the top of your head.
I don't know. There'll be a time for reviews.
You seem quite weary.
Do you think? Well, I kind of think that looking back, I'm not going to be bombastic about it. I'd far rather listen, and because all that matters is getting the response right going forward.
Yeah, but you were poorly, weren't you? And you had COVID-19 yourself. Even when you went back to work, I could see that you were still poorly, and yet you've had to do it because if not you, then who would have taken the nation to where we are now? You've had a massive responsibility on your shoulders, and I'm not blowing wind up your skirt because I give you a hard time a lot. But it has been incredibly difficult for you. To what extent that burden of responsibility, does it weigh you down?
Lots of people ask me this question, and it doesn't. I don't think of it that way. I don't feel that because I feel highly motivated to get it right, and that includes constantly listening to the accusations that you get and listening to the criticisms and saying, well, where have they got a point, and what can we learn from it? And I get up in the morning, and I think, what can I do today to try to get this country's the best possible response? And then I work on that all day, and then I go to bed and I get up and do the same. And occasionally I get a few hours off. This weekend I managed to play frisbee in the park with my kids, and so take some exercise. Is that okay
with social distancing?
Yes, it is, because it's exercise in the park.
Got it.
Exercise in the park. Exercise is one of the important reasons that people can go out. So I do try to take a couple of hours off at the weekend, but it's, you've just got to you've just got to do everything you can to get the response right. So I feel highly motivated, actually.
Are you fully better now?
Yeah. Fortunately, it was only mild. I mean, gosh, other people have had it much worse than me. Well, for about 48 hours, it was really, really tough.
In what way?
I had a very sore throat, so I couldn't drink or eat for 48 hours, maybe. And I had the aching in the muscles that lots of people talk about. But fortunately, it didn't seem to get onto my lungs, so my breathing wasn't particularly a problem. And I was tired. And then, but fortunately, it was relatively short, and then I bounced out of it quite relatively fast.
Were you surprised at how badly it affected the Prime Minister was?
Yeah, because both of us got it at about the same time.
Sure.
And I was within 4 or 5 days, I felt like I was getting much better, and within a week, I was back out at the podium at the press conference. And I talked to him all the way through it. And in the first few days, we seemed to be very much on a par. And then I just got better, and he didn't. And it was strange, because I just thought, well, I'm getting better, he'll get better as well. And then he didn't. And then it does seem to hit people sometimes a second time, because then it came and suddenly he went downhill, and it was quite sudden how he went downhill the second time. I mean, we all saw the videos that were out in the public domain,
Sure.
And him coming out to clap for carers on the Thursday night and looking like a ghost. And it was, it obviously, we all know it hit him very hard.
I mean, he was close to death by his own admission. We have now got the highest death rate in Europe. How can that be? How were we just not prepared?
No, I think we've got to be very cautious with these data. I think we've got to be really careful in how we describe it, because you've got to take a lot of things into account. So firstly, we're one of the biggest countries in Europe, and that matters. So there are smaller countries which naturally will have a lower death rate because they've got fewer people.
Spain and France and the like, comparisons with those countries, even Italy.
Yeah, so Spain and Italy, for instance, don't include deaths outside of hospital in their figures. We didn't used to, because it's harder to count deaths in the community and in care homes, and we now do. And so you'll have seen early last week there was a rise in the number of published deaths here, and that's because we include all deaths from coronavirus, not just those in hospital. So, Spain and Italy are smaller countries, and they don't include all deaths in their figures. So you've got to be very careful about essentially comparing like with like. If you talk to the statisticians and the chief medical officer, what they say is that it's only afterwards, looking back and looking at the total number of people who've died during the peak compared to the normal number, because you've also got to take into account the age profile and factors like obesity, because there does seem to be a link between obesity and
You say the Prime Minister's fat?
I wouldn't put those words into his own mouth. I'd leave you ask him the question and see how he responds. Anyway, my point is on the data, on the international comparisons, you've got to make sure you're comparing apples with apples. And the way to make that sort of comparison, I'm advised, is you've got to look at the impact of, you've got to look at the total number of deaths over the period, compared that to a normal year, and that's the way to make that sort of comparison.
We're over the peak, at least for now, is what we are being told. Let's end, if we may, with a final viewer's question about the tracking app trial underway on the Isle of Wight. And this is what David is saying. If the trials for the new app are not successful, do you have a plan B?
Yes, we do. We'll improve the app, and we'll look at doing it in a different way. And we'll increase the number of human contact tracers, because the app is only part of actually a whole program, the testing, the human contact tracing, and then the technology. It's all about tracing the virus and following the virus as it spreads.
Security issues. Even today in The Guardian, they're talking about security issues and people not wanting to get involved, not signing up because they don't necessarily want people to know where they are all the time.
Well,
I just asked Mr. Ferguson.
well, we wouldn't know where people are all the time. So I've seen those concerns, and they are wrong. They are not based on what's happening in the app. The point is in the app that the data is stored on your own phone until you choose to go to the NHS to get a test if you've got positive symptoms. So, I think I've seen articles about this and questions about this, but they're based on a misunderstanding of what the app does. And to prove the point, we've published the source code of the app, so anybody can go and have a look at how the app works and how it protects your privacy, whilst also critically being so important for the health of the nation. It protects you, it protects the people who you're close to, it protects the community. We've taken those privacy concerns into account in its design. I haven't yet seen a critique based on privacy that is accurate or based on an actual understanding of what the app does. So if anybody's proposing to has those concerns or is proposing to write about them, I would suggest that they go and look at what the app actually does before doing so. Because if you are spreading those sorts of stories and discouraging people from downloading the app, then what you're actually doing is making it harder for us as a community to fight this virus. So I'm being quite robust in my response to these critiques because we have taken the concerns into account. We have an ethics advisory board. We, of course, will be publishing the data protection impact assessment and all of the information around this, but we've published the source code so you can see what the app does. And if you download the app, then the data of who you are in close contact with stays on your phone, and it doesn't go to us until you come to us and say, I've got the symptoms, I need a positive test. Okay. And so I can give people that very significant reassurance. And actually, contrary to some of the media around this, on the Isle of Wight, where it is actually in operation, there have been 2 surveys of who would be up for downloading the app, and one came through saying 80% of people were going to download it, and the other came through saying 75% of people were going to download it. And that is the sort of take-up figures that I expected and very much hope for, and we'll see. OK, just before we let you go, we've kept you longer than anticipated. We appreciate you spending more time to take our viewers' questions. Final thought. Last time we were in the studio together here was February time. Right. Neither of us had any comprehension of what was to come, what this wretched disease was going to do, this virus was going to do, not only to the UK, but to everyone around the world. I'm not sure about that. Oh, really? Did you know? I was very worried about it, yeah. Yeah, and, I first found out about this... But if you knew in February, why were you not stockpiling what we needed? We were. Why were the tests not available? We were building the testing capability, yes. But we still didn't have enough time to do it? Well, we had to... Because it moved so quickly. That's right. What you're saying? That's right. We invented the test in January. In February, we got the number of tests up to 2,000. In March, we multiplied that by 5 times to 10,000, and then obviously I set the 100,000 target. No, Germany. We were the Germans started with this enormous diagnostics industry, but if you look at other countries around the world, we're miles ahead on testing, and we're now one of the world leaders. It's true that Germany has a very high capacity, about the same as ours. So we've basically caught up with Germany that started with this massive capability. And the Americans are also ahead. We're miles ahead of South Korea now, absolutely. So I first found out about, we didn't know it was COVID-19, it wasn't called that, at the start of January. Yeah. No, right end of December, wasn't it? 31st of December? 31st of December is when the Chinese admitted to it. And I found out at the end of that week, on the Friday of that week, and I started having meetings in the department. We discussed it right from the start of January, and put in place. We had the plans, but the plans were in advance were for a flu as opposed to a coronavirus, so we had to adjust them. No, but I've been working on this full time since long before it became a subject of national issue. And in fact, I remember some Prime Minister's questions in sort of February. Standing there thinking, I was sitting there in the House of Commons, all these questions about all the other things that matter in life, and thinking, Nobody's asking about the single biggest issue that's about to come and hit us.
Really?
And it did, yeah.
And why do you think that was? Why was?
Well, because it wasn't. It was a sort of health issue that was going on in China, as opposed to. And I was briefing cabinet, and I was doing statements to Parliament, and people were asking.
Was the Prime Minister not listening?
No, the Prime Minister was heavily involved. Yeah, I told him right at the start. No,
He had a fortnight's holiday, didn't he? On one of his country
no, he
homes.
didn't. No,
Is that not true?
I know it's not true. No. So look, there've been, the people will.
Lots of stories in the press that aren't true.
That I think you're referring to a particular investigation by a Sunday newspaper that was absolutely riddled with errors. And part of what, that's all about the history. What matters is what happens going forward.
OK, final thought before I let you go finally. What are you most looking forward to when lockdown ends?
Going to Suffolk. So I've been stuck in London, and I haven't been to Suffolk, to my constituency, for more than a month, probably 2 months now. I can still do my job as local MP thanks to email and phones, but God, just getting out to the countryside, getting lungfuls of fresh air.
It's good to talk to you, Health Secretary. Thank you very much indeed for taking the time. I know on behalf of our viewers, we really appreciate it.